Welcome everybody. We're super pumped to have you with us here at the Leading Practice for this month's webinar. Super pumped to be able to speak with Dr. Rick Roop. He is a highly experienced chiropractor, and he has a deep passion for helping others. And not only does he have a passion for caring for patients, but recently he's transitioned into helping physicians learn how to treat more patients and generate more revenue. Now, I talk to docs all week long, and I hear that same question over and over and over again. If we get more patients, how can I expand my practice and bring in treatment protocols that will be profitable? Well, guess what? Dr. Rick at Profitable Protocols is going to talk to us about some of the protocols that he's developed, some innovative strategies and techniques that can help you work with your practice to implement them and make it more profitable, generate more revenue, and really increase your quality of patient care as well. So, Dr. Roop, we're super happy to have you with us.
Thanks for having me. Appreciate it.
Yeah, absolutely. Glad you can make the time today. I'd like to just start off by asking, tell us a little bit about your personal injury protocol, because that's the focus of what we're going to be talking about today. I'll just briefly mention before you answer that question. We work with a lot of personal injury docs, chiropractors that are looking to treat personal injury patients. Of course, once we get them the patients, then the challenge sometimes can be giving them a good quality care and treatment using a protocol that really works. So tell us about this new personal injury protocol and BrainView. I had never heard of BrainView until the other day. I can't wait to hear about it.
Awesome. Well, yeah, so at Shepherd Group Healthcare, we've developed what's called a PI protocol, a personal injury protocol. That's a revolutionary solution for personal injury cases. Basically, like you said, it mentioned that this uses BrainView technology, and we're super excited to share that with everybody, because that's a super advanced, brain imaging tool that helps us give a comprehensive analysis of the person's brain and the damage done by traumatic brain injury, concussion, and severe whiplash. So super excited to bring this technology to the chiropractors and physicians across the country.
Wow. Well, those are certainly common cases. We know a lot of our docs are treating them regularly, and very interested to see how this tool can be used. So maybe you could give us a little bit of history on BrainView to start with. What inspired the development of this personal injury protocol, and how does it really address the challenges that patients face?
Right. So, I think most physicians and chiropractors across the country have run into a couple of problems as they, introduce these cases to attorneys, and attorneys introduce those cases to the chiropractors and physicians, because we're not getting the right diagnosis. And if we are getting the right diagnosis, we're not getting a full understanding of the patient's problem and the condition behind the injury that they're facing. And to be honest, that's absolutely at the forefront of what we're trying to do is, help treat the patient as best we possibly can and get the right information to not only to the patient, but to the doctor, so that they can get the treatment that they need, involved in the personal injury case.
Yeah, that's excellent. That's so important. Go ahead. I didn't mean to interrupt you.
No, I was just going to say, that's been the biggest challenge that we've had, because most of the times these injuries are left undiagnosed. And if they are diagnosed, they're usually diagnosed by an MRI, and that cannot be, it's a great tool, obviously, but, that leaves a lot of issues surrounding, like, is this an old injury? Is this a new injury? And there's a lot of data that's not available when you have that MRI image. So that's what BrainView, the BrainView technology solves that, which is pretty awesome in the industry.
Wow. Well, I can't wait to hear more about how BrainView works. So can you tell us a little bit about, in detail of some of it will probably go over my head, but those who are listening in will certainly appreciate it.
Yeah, sure, absolutely. So the PI protocol that we have in place involves three different things. Obviously, the BrainView mapping technology, which is at the absolute forefront of the technology in this industry. Neurologist licensed reading and reports, and then also monetizing that with Dr. Mark Slater's PI Mastermind group. But the BrainView technology specifically, it uses three to four different things as far as EEG is considered: a normal EEG, a QEEG, and an AQEEG, which all combines together to give the most knowledge and information to the patient and the doctors. Super cool mapping technology.
Wow, that sounds very cutting edge. So you mentioned with MRIs and some of the existing methods for treating some of these conditions. How does this PI protocol differ from other solutions in the personal injury industry?
Right. Go ahead. I'm sorry.
What makes it unique?
What makes it unique is actually the amount of information that's gathered from the BrainView mapping technology is super unique in the industry. And the fact that combining BrainView technology, it can help us predict the exact amount of damage that was caused in the injury, how much time and how much effort is going to be needed for that patient to get the quality of care that they deserve, not only now, but 5, 10, 15, 20 years into the future. And that really allows us to really get a firm handle on the amount of injury and damage that's been done. It also can help us map out what's been done in the past versus what's been done in the recent accident, which is super huge in the industry as well, because one of the main things that I would say the opposition always says if you're treating a patient is, this is an old injury. This is something that's happened from an injury that's been in the past. But BrainView allows us to diagnose and show the exact amount of injury that happened recently, and it's not past, and it's actually happening right now.
Wow, that is just that's fascinating. So really being able to differentiate old injuries from new injuries, that's a huge advantage. So now just thinking forward now, one of the things I hear a lot from docs is how they can really they can have enough evidence to use it to support a claim,
right?
For treatment. And so I think you're kind of getting into that. So what kind of data does the BrainView provide?
Right. Yeah, so that's an awesome question. Exactly. So the reason we developed the protocol is because it combines a few things that allows us to do exactly what you just said, is that get a full description of the problem. And so the BrainView, obviously we're using the BrainView technology to map the patient's injury. Once that's done, that information is sent to a licensed neurologist. That neurologist reads the scan, comes up with the diagnosis, then sends a full report and analysis back to the doctor so that we can get an absolute full understanding of the amount of injury that has been caused in the incident, and then how that patient is going to progress in moving forward. And that's all done by a licensed neurologist, which is super huge when it comes to not only getting the right diagnosis for the patient, but then supporting that in court if needed, or in diagnostic purposes, or even being deposed. And that is super unique in the industry as well.
Wow. Yeah, so that really adds a lot of value to the process there. Even I can see that as
Right.
working with neurologists, and so then they get those reports are integrated into the protocol, and then the value obviously is added to the process.
Yeah, that's why attorneys love it so much, is because they're getting a full understanding of the amount of damage that's been caused in their client's injury, and so they're able to get not only the patient the treatment that they need right now, but the treatment that they're going to need in the future, based on the amount of injury and the amount of damage that's been caused in the incident right now. That might take 5, 10, 15, 20 years for that patient to get the treatment that they need, moving forward with the case. Not that the case will go on that long, but the injury might. So, getting those damages awarded to the patient now is super huge.
Wow. Yeah, that's incredible. I see that being a major game changer in the personal injury space. Can you provide a few examples of like some successful personal injury cases that have used this PI protocol and the BrainView technology?
Yeah, well, I mean, we're hearing reports from chiropractors and doctors all over the country that have utilized this technology. That the BrainView scan, the licensed neurologist reading and report are almost it can almost double the amount of reward at the end of the case, which is super amazing because you're able to document fully the amount of damage done. And then that licensed neurologist, as reading the report, is just, unmatched in the industry.
Wow, that is great. So now you also mentioned this PI mastermind group and their involvement and support, which is really nice to hear that, because a lot of times I know when we work with docs, they get new technology, and even though there's some training involved, it's really getting it fully implemented in the practice and working well. It can be a challenge.
Right.
So how does this PI mastermind group help clients to really monetize the technology, and then what kind of resources, support are available to a doctor who gets involved?
Yeah, so we brought on Dr. Mark Slater, who is the PI, has the PI mastermind group, and he's done nothing but help chiropractors and physicians generate more revenue with personal injury for the last 10 to 15 years. So that's his sole focus. And to be honest, that's we were finding that challenging too. How do you monetize the technology, right? That's always the key. It's great to have this flashy new toy that everybody has and you can see and bring it into your practice, and you can scan all these patients and do all this stuff, and everybody loves that. That's great. Yay. But how does that help your practice? How does that help you generate more revenue? How does that help you help patients? So that's why we brought on Dr. Mark Slater. Is he has really come up with a really unique system and a way to approach bringing on and him on and help him monetize the technology. So yeah, he's been a game changer as far as helping these doctors not only not bringing the technology, but figuring out how it's going to help them treat more patients and make more money.
That is excellent. And so obviously, that he's available then to some degree, or his team is.
Yeah, you would get access to his PI mastermind group for a year. And in that year, you're going to learn everything you need to know about how to market to chiropractors, how to market to attorneys, how to get more people in the door, how to get more PI patients in the door, and then how to help treat them the best once they're in the door, get them the right treatment.
That is excellent.
Yeah.
Now, just hearing this, there's a lot of opportunities out there for docs to work different protocols and methodologies into their practice, modalities. When we get down to start talking about cost,
right?
That's obviously going to be a concern.
Yeah, always.
So what are we talking cost wise? I don't know what you want to share on this particular call,
I don't know if, we talk of exact numbers, but always that's a very obviously top of mind for everybody. And I'd say one of the things that we like to state is I would say, unless you absolutely self-sabotage yourself, you're going to be able to pay for this technology and make money using this technology. And I would say, rough estimate, you're going to 8x or 10x your investment within the first year. So that's absolutely, when it comes to ROI, is absolutely amazing. So yeah, it's a great tool.
That's great. And just a kind of a follow-up question, I'm thinking, some docs, they're already treating personal injury patients. Right. But what about a practitioner who is looking to expand maybe his patient care and has never treated personal injury before?
Right.
What's the learning curve, and what's their level of confidence that they can have that if they brought this protocol in, they can have success with it?
Right, absolutely. So first of all, the BrainView technology is super easy to run. The scan takes about a half hour. It doesn't take up much space in your office. It takes up, we recommend that the doctors put it in the same room that they're doing the X-ray in. You don't have to have a special person or a special training to run the technology. You just have a person that can be trained up. So we offer the training involved with getting the person competent on running the scans. Then obviously those scans are sent to the neurologist and they're read and sent back. That's all done via a HIPAA compliant portal, which is super cool. Then once it's up and running, it really is pretty simple to move forward with it. if you're not super involved in PI now, I would say this is a great way to dip your toe into the pool, because you are going to be supported by by the licensed neurologist. So it's not you making the diagnosis of a TBI, because a lot of times, unfortunately, the stigma behind the chiropractor can be there, and that's not always the greatest thing, but we have to address it and just move forward. But having that licensed neurologist read that report is super amazing. But like you said, even if you're not doing a ton of personal injury and you want to use the BrainView or the BrainView protocol to develop your practice, you don't have to have every scan sent to a neurologist. So, like, something that I'm super passionate about is football. I love football. So in our office, what we're going to do is we're going to do a pre and post scan of a local high school. So we're bringing in all the football players before the season. We're going to scan them. That means 20 to 40 patient families coming into your practice before the season starts. And then if anything does happen to any of those players during the upcoming season, we can bring them back in, we can rescan them, we can show them the difference and show them what the amount of damage that was done in that with that concussion or that TBI, or hopefully not much more than that. But just having that availability, and that's a huge practice builder, because now you're introducing your practice to a whole new generation of patients, and then also the families that go along with that player too. So, I mean, it can be used in a number of different ways, and obviously not all those scans are sent to the neurologist. You don't have to send every scan that you do to the neurologist, only the ones that would make sense.
Yeah, that's incredible. And just being able to help high school kids, we know that's been an ongoing concern, right, with sports, especially with football and some of the other contact sports. So that's really incredible that you're able to make use of that.
Yeah, I'm glad you brought that up too, because sometimes we get caught up in the amount of revenue generated and the amount of patients that you can bring in, and it's easy to get caught up in the numbers. But being able to help more patients and help your community, and being at the forefront, obviously, of technology, and having something that nobody else in your community does is going to be amazing, and it's going to be a good way to put your practice on the map if it's not already, and then if it is, add to it.
Love it. Very great. That's excellent. So you mentioned earlier as well, dealing with attorneys and sometimes insurance companies. That's obviously has its own set of challenges and benefits for a dog. We want to work together with them. So how could legal professionals, attorneys, insurance companies, how can they benefit from using this PI protocol? What impact would it have then on their clients to benefit them?
Yeah, so I mean, if they do have a client that has been in an accident or has an injury, a brain-related injury, you're going to absolutely want to have that patient scanned, because it's going to document with 100% certainty the amount of trauma or amount of damage that's been caused by that accident. Not only that, then there's no denying that this has happened. Like, once the person is mapped and the image has been scanned and sent over to the neurologist has diagnosed the patient with a TBI, concussion, or whiplash, and then sent back to you. There's no longer a battle or a challenge on what's being, what treatment you're doing, or how much treatment you're doing, or is that treatment warranted? Because now all of a sudden it's there, it's concrete, it's diagnosed, it's happening, and this case is moving forward. So attorneys love it, like I said previously, is that they love it because it's going to document that injury, and it's going to most likely double the case value in the end.
Wow. Yeah, that's incredible. That sounds very, very, very helpful to the industry as a whole. And I think probably you've given us a really nice rounded out picture of this protocol. What are the benefits? How it can help the industry, patients? It sounds very easy to implement and get into the practice.
Yeah,
probably a lot of our viewers right now are probably wanting to see a little more detail about, well, how does it work? What does it do? Do you have anything you can share with us about?
Sure. Yeah. Let me just pull pull up the screen here and we'll share a little bit about the science behind it. So this is how the BrainView technology works. It does an EEG, and that's pretty standard when it comes to like stuff that's been done in the past. It does a QEEG, and that's also been a little bit done. But offering the amplified integrated electroencephalogram and the color density spectral array is really kind of new to the industry and game changer. And that's what does the brain mapping, or the brain map that we send to the neurologist. And that shows the amount of damage that's been done. So like we've said in the past that, BrainView helps you map the brain, but what kind of conditions can this accurately diagnose? Obviously, traumatic brain injury is at the forefront, and concussion is at the forefront of this. But BrainView and the technology associated with can, also do acute brain injury, ADD, PTSD, cognitive impairments. Some of the things that I like as a chiropractor are migraines and hearing disturbances, as far as anxiety and depression as well, which, I think is also huge. So not only can BrainView diagnose accurately the TBI and concussions, but can also do a bunch of other stuff that can help you develop your practice and treat more patients accurately.
Wow, that's incredible. I had no idea that all of those conditions could be diagnosed.
Right.
With
and
this.
then,
Yeah.
As far as treatment is concerned, BrainView also does some treatment and with neurofeedback. You're not going to be treating traumatic brain injury with BrainView, but with the neurofeedback, you can definitely make some treatment options available to the patients as well. So that's really nice too when you're bringing this into your practice.
Excellent. What other medical support do you have for this? Because you mentioned it's a newer technology. I'm sure a lot of the docs are wondering, okay, well, how new is it? What other technical or supporting documentation?
Right. Well, so for most chiropractors, there are CPT codes associated with diagnosing and running this scan in the practice. So if you're integrated at all, those can be billed through the medical doctor, but also some chiropractors can bill that as well. So there are CPT codes that can be utilized with BrainView moving forward too.
Okay, excellent. Excellent. One other question I had that they may be wondering is, with regard to the neurologist, how do they go about finding? Do you have a network of neurologists, or
Right, exactly. That's super important because the scan is actually sent to a licensed neurologist in your state. So that neurologist be licensed in your state where the accident occurred. So we do have a network of neurologists. So you'll be working with one or two specific neurologists that you send your scans to, and that person will be licensed in your state. So there'll be no contradiction when it comes if they need to be deposed. That can be done pretty easily. And then if that case goes to trial, obviously, that's the person that's going to be up there defending the diagnosis, and not the chiropractor that is like did the scan. We're going to do the scan, but we're not on the hot seat up there being deposed and in front of the attorneys if this case comes to trial.
Wow, that's very helpful. So that really starts to minimize the risk,
right? Exactly.
to the practitioner, which is really, really helpful. Is there any other risks associated with an investment like this or implementing this in the practice?
Well, I mean, obviously we talked about cost and that, but other than that, I mean, it's all going to be pretty self-explanatory. There's really no inherent risk behind running the scan. It's a non-invasive scan. It's FDA approved. And so there's really no risk as far as to the patient or to the doctor for doing the scans. And it's a minimally invasive to the patient. So you can't beat that.
Yeah, that's really appealing. I love this whole technology, Dr. Roop. And again, I'm new. I'm not a medical professional. We work with them regularly, and I talk to them all the time. But right. I was really, you got my interest really piqued when you started helping me understand what you're
Right,
doing with this technology, and it really is just amazing. If a doc wants to learn more about
right.
the program,
Absolutely.
what would they do? They reach out to you, or
Yeah, absolutely. I'm at the forefront of the the chain. So the first thing would be to do is to reach out to me, and we'd have a conversation. Super easy 5 to 10 minute conversation about what you're currently doing in your practice, how this might help you in your practice, and then from there just determining, is it right for you, and if it is, how can we show you more about it, and how can we get you involved.
excellent. So we'll make sure that that's available for you at the end of the call today. Those of you viewing the webinar will just look at the slide coming up next, and then we'll look forward to booking a call with Dr. Roop, spend some time with him, learn more about this amazing technology. You just won't regret it. It's just phenomenal what they're doing to change the personal injury space. So thanks for joining us, and thanks,
Thank
Dr.
you.
Roop, for the time today. Really appreciate that thorough explanation of what you're doing, and look forward to seeing how this continues to transform the industry in the
Awesome.
personal injury
Thank you so
space.
much. Appreciate it.
Yeah, thank you.